February is Heart Health Month, and next week begins Congenital Heart Defect Awareness Month. Congenital heart defects are the most common type of birth defect and affect thousands of families each year. Joining us today, we have Dr. Lance Lewis, a cardiologist with Novant Health, to help us better understand congenital heart disease and really the importance of early detection. So thank you for joining us. I appreciate it.
Thank you for having me.
We said it's common. How common is congenital heart disease really?
Well, it is in the United States, 1 out of every 110 births has congenital heart disease. That ends up being one baby every 15 minutes in the United States.
It's very common.
Very common.
Yeah. Are these defects always diagnosed at birth, right at birth? Or?
Well, it depends on the severity, but typically they are when something needs to be done about it. That is to say, a cardiologist, or usually it starts with a pediatrician, listens to the heart, and when they hear usually a funny sound, we call them murmurs, they get more attention with some imaging, and then they get further care. Now, they can be picked up later in life, and people can even live the majority of their lives without knowing they have it, again, depending on the severity.
Well, I told you I've interviewed a couple of different athletes who found out that they had some kind of heart defect that they never knew about, for years. And unfortunately, and I don't know if this is common, but in a couple of those situations, they happen at very inopportune times, where there was sort of a traumatic event that sparked it.
Correct, and sometimes that's what brings it on, because you need more of your heart then, so sometimes those defects really don't show themselves until you really are pushing yourself.
Is this kind of thing hereditary? Is that one of the symptoms or the signs that you should sort of leading you to get that early detection?
Frequently there can be a genetic component, but not always. The detection usually comes on when there are certain signs or symptoms. So not just the murmur, sometimes in severe cases people will turn blue. They're just not getting enough oxygen.
Oh, wow.
So the fingertips, the lips, or even the entire body can intermittently turn blue in the more severe cases.
So I have a healthy baby for all intents and purposes, but I'm a parent and I just want to know, what should I look for?
Well, the best thing to do is, if they're eating right and gaining weight as they should and their breathing seems normal, they're probably fine. But obviously, go see your pediatrician. If they put a stethoscope on them and take a listen, they should hear it if there's something sinister going on.
And be ready to ask questions. If you really suspect something, that's what your pediatrician is there for.
Absolutely. You're your best advocate and your child's best advocate.
True.
So it's best to ask.
Yeah. All right. Thanks for coming in. Appreciate it. Great information.
Thank you so much for having me.